A groundbreaking study reveals that years lived with disability, YLDs, could be a critical indicator of long COVID risks, particularly in regions where symptoms are often underreported, according to global researchers. This finding aligns with data collected during the pandemic, highlighting a potential early warning sign for long COVID in low-resource communities. The research, published in MedResearch and Reviews, onlinelibrary.wiley.com/DOI/10.1002, MDR2 70023, used the Global Burden of Disease 2021 framework to analyze 2020-21 data, focusing on the direct impact of long COVID on health systems. The study examined YLDs across 920 locations, suggesting that these figures may serve as a proxy for future long COVID risks in 2022 and 2023. Researchers also assessed patterns of inequality to identify vulnerable groups, revealing stark disparities in health outcomes globally. The study authors emphasized that YLDs are more suitable for measuring long COVID burdens than other metrics because they account for both the prevalence and severity of symptoms, offering a more nuanced view of non-fatal health losses. Even in wealthy nations, significant inequalities persist, with age-standardized YLD rates higher in low- and middle-income countries, LMICs, particularly in sub-Saharan Africa, South Asia, and Eastern Europe, regions where long COVID research remains limited. These countries face challenges in healthcare infrastructure, diagnosis, and management, as seen in nations like Mozambique, Malawi, Ethiopia, and Iraq. Among the 10 countries with the highest age-standardized YLD rates in 2021, 80% fell into the lowest socioeconomic categories, underscoring the disparity in health access. While high-income countries generally had lower overall YLD rates, they still exhibited large regional gaps. For example, rural areas in the U.S. and other underserved regions saw higher YLDs, illustrating how national averages may mask local vulnerabilities. Co-first author Dan Shan, an independent researcher, noted that even within high-income countries, communities experienced divergent impacts of long COVID, with effects not evenly distributed. Without granular data, certain subgroups might be overlooked in policy decisions. The study also found that women aged 20 and older bore a disproportionately greater long COVID burden compared to men, a trend consistent with prior research. The researchers warned that high YLD rates could signal systemic vulnerabilities and entrenched health disparities, potentially leading to prolonged long COVID impacts if addressed. However, this conclusion invites debate. Are these inequalities due to structural issues or simply gaps in data collection? As the study concludes, without targeted interventions, the long COVID burden could persist. But understanding these disparities is crucial for equitable healthcare strategies. Our underwriters' unrestricted financial support provided by